There we go.
There
So
we
once
go.
again, thank you so much for attending another monthly class. And I have with me my executive director. I'm gonna start off by saying that, Mary Jane. And then I have Judy, who is also one of my co-workers. She's awesome. She has a lot of questions and knowledge as well. And then I have my lovely Christina.
Hi.
She is also an assistant coordinator with this program as well. So, and we are going to be giving welcome to everyone who has just came in. Thank you so much for joining us this afternoon. Again, I was just introducing some of the co-workers. Judy is up top on the right. And then we have Miss Mary Jane Williams on the left. And then we also have Christina. And
Hello.
then I'm in the middle. Hi, everyone. Thank you so much. So we're going to get started because I know we have a lot of information to share with you guys. I just want to remind you guys, we do have a small group that it's on Fridays. We'll start a bilingual class starting October 21st, but we do have also, you have an opportunity if you want a bilingual information given to you in English or Spanish. Christina is always there available if you want to come in on Friday with us. We'll be making the profile. We'll be using some of the tools that we've been using. I will send that information to you guys so you can start working on that. And it'll help you in developing your profile. So if you need any documents, you want to come in tomorrow, you want to go back and look at some of the classes that have already started, you're welcome to do that. Just send an email to me and I'll send them right back out to you with all the documentation so you can get started and you'll be just like you've been with the group the whole time. So again, I want to welcome our speaker today, and it is Mary Jane Williams. She's our executive director for Family to Family Network. And so we're going to let her get started because I know she has a lot of information. And just remember, if you have any questions, please can you hold those questions to the end and we will come back and we'll make sure and just write it down if you're going to forget, because I know a question will come in, she'll start talking about something else, and so hold on to that question and you'll get it answered at the end. Okay.
Or you could type them in at the chat too, whatever's best for you.
Yes, if you feel that, and never, no question is silly. Any question, I bet you there's someone else besides you wanting to know that same question. So go ahead and put it in the chat box, or you can wait to the end if you want to ask the question yourself. It's okay. So we're going to go ahead and turn it over to Mary Jane Williams, and she's going to get started with Medicaid waivers.
Well, welcome everyone. It's so good to see so many of you taking time out of your lunch to get come hear about Medicaid waivers. I am going to share my screen so that, can you all see that?
No.
No?
Not yet, no.
It's slowly coming.
Okay. There it is, starting to show.
Okay, you got it?
Yes, ma'am. Got it. Just maybe do the slideshow and that's it.
There we go.
There we go. Thanks.
All right, everyone, welcome. My name again is Mary Jane Williams. I'm Executive Director of Family to Family Network. And so I'm glad to have you here today. I have to find the little, just for those of you that don't know much about Family to Family Network, we offer a variety of services. We do case management, informational referral to community resources. This project that is sponsoring these weekly or monthly webinars. Sorry, you guys don't want to do this every week. But it's really about creating person-centered financial plannings and as well as support services and planning for that future. Judy helps with a lot of training. She's been organizing every other Wednesday. We do have support groups that meet every Monday night. And then we're supposed to have our annual conference in January, but we've had some hold up with HCC wanting to be back in person. So we may be postponing till March. So the first thing I want you to do, the other thing I want you to do is if you have questions, just type them into the chat. Christina will be monitoring them, and then we can see, we can try to see what they are. So right now in the chat, if you would, put in a 1, 2, 3, 4, 5, or 6. One is, what do you know about waivers? Nothing. That's why I'm here. 2, you've heard of them but don't know. 3, my child's on a wait list. 4, my kid has a waiver but don't know how it will help them or what will happen in adult life. Oh, this was 5, but that was because I had put it in there for college 2 weeks ago. And or 6, I know a lot about waivers. So actually I'm seeing some 3s, a couple of 1s, great, that you're saying that, and 2s, have heard of them but do know what they mean. And a lot of people are on wait lists, so that's good. I hope for those of you that are on number 1 or 2, that you'll actually learn how to get on a wait list so that you can, your child will have hopefully services when they become an adult. So these are my children, and I will disclose that I am not employed by HHSC or the Health and Human Services Commission, and I encourage everyone to verify information on the HHSC website. Back 25 years ago, when my children were young, I put them on the Medicaid waiver wait list. And it took approximately 11 years for my son Christopher and Rachel to come up on the list. At that point, Rachel, really, we could tell that she didn't have an intellectual disability and she was going to go off to college. So we turned down the waiver services, which is an option for everybody. So you can put them on the list, and when it comes up later on, you can turn it down if you don't think your kid needs it. Christopher, on the other hand, we knew that he was going to need supports into his adult life, so we did not turn it down. Let's see here. So I'm going to talk a little bit about the acronyms that are going to come into play, what the waivers are and the eligibility, and then community first choice. And I'm also going to brush on ABLE accounts, as well as some of the big changes that are coming down the pike with waivers. For those of you that are still in education, remember you're admitted, you're entitled to that education, and it's supposed to prepare you for the future, for their education, employment, or independent living. And I hope y'all are focusing on that as you go to your IEP meetings, or if you're in a private school, that you're really thinking about what's going to happen when the school stops. And that's what this whole project that we've been working on is really about, is planning for that next step. As Inger talked about in our small groups, this is one of the resources that we go through, and we're going to be talking about eligibility specific supports that your child might have, and what sort of supports are they to help you qualify so that you could so that they could help reach their housing or career or job goal. And so it's one of the great tools that you'll be talking about in your small groups. So again, adult services are not guaranteed. It's very disheartening when we get a phone call at Family to Family Network and a family has not, did not know that they had to be on a wait list. We had a call like that over the summer, and it was an emergency situation, and it's really hard then to navigate into those adult services. You have to qualify for everything, and every different program has different rules and regulations that you have to follow. Oops, gosh, what's going on with my computer? And then adult services are not free. They have to be paid for somehow. Whether it's you're paying for it yourself, or you're lucky enough to have a waiver and the waiver is paying for services. The only other thing that's free is Texas Workforce. You can get services from them, and they're free as well, but I'm not going to talk about Texas Workforce today. So really, you've got to have a waiver to pay for anything or have a lot of money. So I'm just going to pop these up here and just talk about a lot of them. There's a lot of new acronyms that you're going to have to learn when you get into the adult health service system. You're going to hear a lot about PASS-HAB or CFC. Often you'll see CFC PASS-HAB. That's just attendance services. For those of you that are sitting on a waiver, this is one of the things you're probably waiting for, is that attendance to come and take your son or daughter out into the community, or work on skills at home. But that's the term you're going to hear a lot, is CFC PASS-HAB. The local authority, the LIDA, for those of you that live here in Harris County, it's the Harris Center for IDD and Mental Health Services. If you're over in Fort Bend or Waller, or I don't forget what other counties, they cover about 10 counties. It would be Texana. If you're up in the Montgomery, Liberty area, that would be, I've got it on a slide soon. So Tri-County Services, there's 3 counties that they cover. You'll also hear the MCO, Managed Care Organization. The state of Texas decided that instead of having HHSC monitor Medicaid services, they decided to outsource it to insurance companies. And so you're going to hear a lot about MCOs. The MCOs are there to help the state save money. A lot of services are dependent on a level of need. So you're going to see that LON when you actually start to receive services. It's going to be a lot of your services are based on that level of need. And then here are some of the waiver programs, and I'll talk a little bit more about them. But there's MDCP, Star Plus HEBS, which used to be called CBA. Deaf, blind, multiple disability, CLASS, HCS, Texas Home Living, and the YES waiver. The YES waiver is youth empowerment services, and that's on the mental health side. You have to be younger than 18. I'm really not going to talk a lot about that waiver, mostly because a lot of you have kids with autism or intellectual disabilities, so you're probably going to fall into these other categories. If your child does have significant behavior needs, it might be worth looking into the YES empowerment services. I know there's a wait list for that as well. So as I said, school is an entitlement, and then waivers are non-entitlement, meaning that you have to qualify for them. And over here on the left side are the services that you're entitled to: a nursing facility, a state supported living center, a community ICF, and then community first choice is something that you're entitled to. And I'll talk about how you might be able to access community first choice at the end, closer to the end. But just so you know, there's 2 different sides: entitlement services and non-entitlement services. And those waivers are all non-entitlement services. So why do they call them waivers? Well, they stop or override or waive the rules, the Medicaid rules, to allow different service delivery options. And those options are usually a nursing facility or an intermediate care facility for individuals with developmental disabilities or intellectual and developmental disabilities, or the state supported living centers. For those of you that don't know, there are actually 13 state supported living centers in the state of Texas. They only house about 3,000 residents, and their budget is a lot more than any of our local authorities. Individually, their budgets are greater than the budget of our local authorities. The Harris Center serves about 20,000 people. Richmond State Supported Living Center has 320 there. So just keep that in the back of your mind. So here's a little bit about each of these programs. MDCP, of course, serves those children and young adults who are medically dependent, meaning most likely you would need to be placed in a nursing facility. And that program actually ends at age 21 and they transition into the STAR Plus Home and Community-Based Services waiver. There's, of course, the deaf, blind, multiple disabilities, and that's just a cost-effective alternative to institutional placement. And then CLASS provides services to people with related conditions, and that's really waived off of the ICF for IDD. Oops, sorry. To get on those 3 wait lists, you have got to call the Health and Human Services Commission, and my screen is in the way, so I can't. It's 877-438-5658. And you call them and you say, I need to put my child on the waiting list for whichever waiver this is. They will actually send you a letter every year asking you if you want to keep your child on the waiver. So in that vein, it's really important that if you move, change phone numbers, you call them back and you update your information. Otherwise, if they can't find you, they're going to assume that you don't want the services. So it's really important to update your information. The HCS or Texas Home Living waivers, you're going to have to call the local authority. And here's the numbers for the Harris Center or Texana. And you could go to Family Network's website. We have some under the resources, the Medicaid resources, you can find all this information. But you're going to have to call and ask to be placed on the waiver wait list. I'd also recommend, if you're calling your local authority, to ask them about respite services. They have general revenue funds to actually provide respite services. I'm sure there's some income requirements for that, but at least it starts to get you in the system with them and you're on their radar. So just so you know, it's a good idea to call them and get not only on the waiver wait list, but ask about respite services. Oh, I told you, the 3,000 people at the state supported living centers. And this was back in 2018. You can see in Harris County, there were like 21,000 people waiting for HCS services. So the state calls them an interest list. So if you want to learn more about the interest lists, they are 8 to 16 year wait now. It's not good. And the reason that is because your state legislators just have to make decisions around budgets. Medicaid, the state could actually pull down a lot more Medicaid dollars, but they have chosen not to because they have to match it. And so they've decided only to match a certain amount. And so they don't get as much Medicaid dollars. And that means all of you are waiting for services. So it's important to tell your legislators or stop by their office sometime once they're back up and running and let them see your son or daughter and say, hey, I'm on this wait list and I've been there and I'm number 20,000 or something. What's going to happen? They don't believe the wait lists are true. The interest list, so to speak. Here's the Texas Medicaid system. STAR is that program that people get their medical plan from. And so almost everyone that ends up with on a waiver will end up on a STAR program for medical coverage. We also have for people who are low income, they will be children, especially, they get served by STAR for their medical needs. STAR Plus is the one for people with disabilities or people who are 65 or older. And then they can get their health care and their long-term services and supports through the medical plan. And then, of course, we have CHIP and Children's Medicaid. They cover stuff for kids, low cost or free health coverage. As I talked about earlier, managed care is taking care of the Medicaid for the state of Texas. And so we are dependent on specific groups, insurance companies. For the most part in Harris County, for Star Plus and Star Kids, it's going to be AmeriGroup, United, and then Molina and Texas Children's for Star Kids. So yeah, those are the big three here. So every time you see a news report about how much money United Healthcare has made this year, or AmeriGroup, keep in mind they're cutting services on your back, your child's back. So each of the long-term services and support waivers have, there's a great comparison tool. It's linked on our website, but it shows across the top how what's the maximum cost that is involved, what's the financial eligibility. So the financial eligibility is 300% of SSI monthly income limit. So right now that's about $2,800. And that's for the person with a disability, not the family. The only time family income sort of gets played into it is over on the Texas home living side, especially for kids under age 18. So that's why it says, yes, they're consideration of parental income. Residential services, you can see across here, Star Kids doesn't have a residential component. That residential component would be a nursing facility. Class doesn't have a residential component. That would be an ICF facility. HCS is the one that has group homes or host home companion care. And then the deaf-blind multiple disability one also has group homes or assisted living facilities. The Star Plus HCBS waiver does have assisted living facilities or adult foster care, which is sort of like the host home companion care that HCS has. When you go onto that comparison tool, there's a ton of services. I've only listed some. You can see here what some of them get. Sometimes they're called different things for different waivers, even though they're all the same thing. I'm trying to think of one that's, I think the audiology one, you'll see here, it's like these three, but then for other ones, it's probably called something else. Just know that you can go look at this list and see all the things that are provided by those waiver programs. And it's going to be based on your budget. So I'm going to talk about the past eligibility for HCS, Texas Home Living, and Community First Choice. Your three paths, of course, are having an intellectual disability, having autism, or having a related condition. And I'll tell you a little bit about each one of those. Of course, ID means that you've got to have an IQ below 70, and then have a lack of adaptive behavior functioning based on their age. And the symptoms have to be, the intellectual disability needs to have been determined before the age of 18. And that's important for some of you. You may not have had an IQ test for your son or daughter before the age of 18. And we know a family who has a daughter who's nonverbal, never did an IQ test with the school district. And then when she came up on HCS or whatever waiver it was, they looked at intellectual disability and they said she didn't have an intellectual disability because she had never gotten it determined before age 18. So keep those little things in mind, that if you think that your child has an intellectual disability, at least get the school district to do an IQ test when they're 17 and you know they're getting close to being 18. And then they base the severity on, different levels. If your If you have autism, they're going to look at all those deficits in interests and all that stuff that we all know from autism. But for HCS and Texas Home Living, they're also going to put in that IQ test. And I think with that, the IQ for autism is like 75 instead of 70. Related conditions. These are some medical diagnoses that have occurred before age 22. The Health and Human Services has a list of them. They usually result in limitations of 3 or more of the following areas: self-care, use of, communicating, learning, mobility, self-direction, and capacity for independent living. So some of those that might fall under this category, like cerebral palsy or epilepsy, any other condition that's not mental illness. And there's that IQ and adaptive behavior functioning level that comes into this also. Again, it has to be started, the disability has to have occurred before age 22, and it's going to continue forever. So when your child comes up on the waiver wait list, the local authority is going to do a determination of intellectual disability, better known as a DID. I know with everything that's been going on with COVID, they tend to ask you to send in information from the school district. So if the school district has done some testing, send those evaluations in as soon as possible. Otherwise, you're going to have to be scheduled to meet with a psychologist at the local authority for them to do some testing. And then there's a process, and supposedly the determination of intellectual disability is supposed to be given to the family within 30 days of assessment. We're not seeing that happen. Judy probably could jump on and tell you. And then your results can be appealed, which is important for you to know if they say your child doesn't have an intellectual disability. Once that is determined, a level of need will be given to your son or daughter. Intermittent, limited, extensive, pervasive, and pervasive plus. It's interesting that level of need 6 is higher than level of need 8. I know, confusing. But yeah, these levels of need will then determine the rates of pay that are paid, as well as what types of services you might be eligible for. I know we get this question a lot, is that can parents be paid attendance? There's some rules around this. And this is on one of the forms that employees or the employer has to fill out. They can't be the guardian of an individual or the parent. Or under HCS and Texas Home Living and class, depending on what it is, respite or attendance services, it can't be a person who lives with the individual. Now under class, that only is for respite. The person can't live with the individual. So there's rules around everything. But I know that over this last year with COVID, those rules have been sort of set aside so that parents could get paid to be attendants. This is one program where parents can get paid. It's under HCS, it's host home companion care. And what happens is, as a parent, you get paid a per day rate based on that level of need. And you're supposed to do all those, help with all those activities of daily living, transportation, behavior support, medications, and then getting them out in the community. it's important that families understand this, is that once you take this rate, you cannot get attendant care. And depending on what program you're using, I mean, we use consumer directed services, and my son is at a limited level of need. Well, I'm only going to make about $50 a day. Well, my attendant right now gets paid $20 a day under consumer directed services. So for me, I mean, $20 an hour for me, this doesn't make enough money for me to pay her for the hours that she works. So it's all based on each person's sort of needs and what works for you as a family. It's just, this is one of the options for parents to be paid under the HCS program. As I talked about consumer directed services. We use this under HCS. I'm supposed to recruit, or my son is actually the employer, recruit, hire, and train your employees and backup employees. And then we can set wages and benefits based on the budget, set schedules. We have to submit timesheets still, as well as verify hours on the EVV system, the electronic verification system that they're using. I'm hoping they're going to give up the timesheet soon. But that consumer directed service agency, or what they call as a financial management service agency, FMSA, they train you on how to hire your employees. They train you on all the paperwork that has to be done. And then really, as a CDS employer, all we have to do is do the timesheets. They deal with all the payroll processing, the CDS agency, and they deal with taxes at the end of the year. So they send out all the tax forms for all our employees, et cetera. So we don't have to worry about that. It's really pretty easy process. I know a lot of times when you get, your name comes up on the list, the local authorities are going to tell you to select a provider, and nobody really talks about consumer directed services. You'll still have to select a provider. My provider, all they do is a nursing assessment, which is required for HCS every year. And then we do everything else. We can, we actually could do consumer directed services for that too, but I just don't know how that works because it's nursing. But it just, I think consumer directed services is easier, and we have a lot of freedom, and my son will have a lot of freedom as an adult to set his hours that he wants an attendant. When you go an agency model, often the agency determines what hours the person is going to come. It's not as really as flexible. Oh, this is class. What did I put this in? Oh, class, you can see their rates are like $13 an hour. Employment assistance is $25 an hour. All the rates you can find in the at HHSC, and I've got them listed as a resource at the end. We did talk about the Star Plus HCBS waiver, and you cannot have one of those other waivers to get into Star Plus HCBS waiver. You have to already be Medicaid eligible, and you have to be over 21. Once your son or daughter becomes an adult and they get SSI and they become eligible for Medicaid, if you don't have a waiver, this is one that you might be able to gain access to. But keep in mind, the services are all coordinated by the managed care organization. So who knows what people are getting out of it. I know that if you do have the Star Plus waiver, you do have access to nursing facility or assisted living facilities. So if you can find an assisted living facility that will take your son or daughter, that is an option. So what do you do if you are on a wait list for a waiver? Again, you're going to have to talk to your managed care organization. So if you have Medicaid right now, or if when your child, son or daughter becomes 18 and you apply for SSI and they have Medicaid, you will access your managed care organization, that insurance company, and you're going to call and ask them about, oh, I don't remember this. So yeah, that's, so in order for your son or daughter to get SSI, they have to apply at age 18. They have to have a disability that prevents them from working at substantial gainful activity, which is $13.10 a month. And then they have to have resources less than $2,000. And that's really important for families to understand, is that resource limit. So anyway, I talked about community first choice as an entitlement, and this is what you're going to ask your managed care organization for. Again, they're supposed to be an IQ of less than 70. It started before age 18, or they can have a related condition with moderate, severe, or profound adaptive behavior deficits. There's a few services that are offered. Community first choice, again, is part of the ACA, or formerly known as, for many people, as Obamacare. It's an entitlement. Again, remember we talked about non-entitled services waivers and entitlements. So if you've got Medicaid, you're eligible for community first choice, and that will give you PASS-HAB services or personal attendance services, emergency response services, and then support management, which is really the managed care organization managing your services. The important thing that I want you to know about PASS-HAB is that they're supposed to assist with activities of daily living and, IADLs. So it's non-skilled assistance, household chores, escort services, like to take them out in the community, assistance with health-related tasks, or maintaining skills for people. The big thing that you need to know about, it's instrumental activities of daily living. A lot of times when you call your managed care organization, they're going to ask you, well, can your child feed themselves? Can they go to the bathroom themselves? Can they get dressed themselves? Can they bathe themselves? And you're going to say yes. Guess what? There is another part of it, which is instrumental activities of daily living. So they can't just discount you from community first choice services, because there's a lot of other things that are involved. Meal planning, managing your money, shopping for food, participating in the community, being able to get out and go to the library, or go to church, or your other religious offerings, shopping, helping, perform those household chores, communication by phone or other media. Those are instrumental activities of daily living. And so many of our young adults may be able to do some of those activities of daily living, but it's those instrumental activities of daily living that they can't do easily. And so that would qualify them for community first choice services. How am I doing on time? Emergency response services are one of those services that are available for CFC also. It's usually for people who live alone and don't have a regular caregiver. It's sort of like, I've fallen and I can't get up. So it's really for people that don't need extensive supervision, but might need somebody, to check in, or just be able to have an emergency system available in case something happens. The bad thing about Star Plus is that the pay rates for attendants are basically $10 to $12 an hour. It's really low. So finding attendant care is good. Finding those attendants to take care of your son or daughter are going to be very difficult, especially right now when so many people are pushing for $15 an hour wages. You can make more money working at McDonald's than you can being an attendant. So if you're interested in what's going on at the federal level, there's a really big push to make sure that direct support professionals, which is what attendants are called, should earn a living wage, and they should. They have some hard work, and they need to, and they work with some of our folks that don't have a lot of skills, and they should get paid accordingly. So another thing to bring up to your state and federal legislators. So of course, getting community first choice services is a process. You're going to contact your managed care and request PASSHAB services or CFC. That goes to the local authority for the DID and a level of care assessment of needs. Then that gets sent to the state where they review it and approve it or disapprove it. If it's approved, then the local authority does a functional assessment, determines service needs, and then the MCO authorizes the services. If you're over 21, the local authority does service coordination, but if you're under 21, the managed care organization provides service coordination, meaning they'll determine what services and pay attention to all that stuff. There's been some concern about whether what gets reviewed and approved actually gets authorized over here by the MCOs, because the MCOs are in charge. And remember, they were charged by the legislature to help reduce the Medicaid budget, so, and save money for the state. So it's important to ask questions. All the waivers except for CFC offer employment assistance or pre-vocational training or supported employment. Usually for these services, you have to have TWC, Voc Rehab, close your case. So you've got to first go through Texas Workforce and then have Texas Workforce say they can't help you anymore before you're allowed access to these services. We have supported employment in our budget. I use that for transportation to his job. Right now, we've gone back to Texas Workforce VR to find a new job. And once we find a new job, the agency that I'm working with will also be able to access supported employment just in case he needs further job coaching or something happens, and they can go back out on the job and help resolve issues. So there are opportunities for extra employment assistance under all the waivers. The reason I bring up ABLE accounts in this presentation is because so many of you are on wait lists, and then if you want to access services after age 18, you're going to have to set aside some money. Anyone can make a contribution to a person's ABLE account. The ABLE account is set up for the person with a disability. They're the account beneficiary, and family and friends can put contributions into that ABLE account. The most you can put in is $15,000 a year. If it's made by the person with a disability and there is work contributions, like money from work, they actually can put in a little bit more than $15,000. And then the first $100,000 in ABLE accounts is exempted from that SSI $2,000 individual resource limit. You've got to have a disability before turning 26, which many of you have that. It's easy to do that. I think at the federal level, they're trying to increase that age, mostly because for people who have been in accidents or perhaps even veterans being able to access ABLE accounts just to save money. People can't live with just $2,000 in savings. You're automatically eligible if you meet the age criteria and you receive SSI or SSDI. I'd encourage you, if you have an IEP, to reach out to any of the ABLE account organizations. Texas does have an ABLE account. I wouldn't say that it's the best, but it's a good start. There are some other states that you can get an ABLE account at. Their fees might be lower. They might have debit cards associated with them. Anyway, ABLE accounts can be used for any expense that improves the health, independence, or quality of life for a person with a disability. And so it's really a great place to just save some money and then use it on those things that are not covered by SSI. SSI is just housing and food, basically. And even at $794, I think it's hard to find housing and food, pay for housing and food. The bad part about ABLE accounts is that they will be, if the person with a disability dies, they'll be used to reimburse Medicaid. You can't leave an ABLE account to someone else. So I just want you to know that. The other thing is, if you have started a 529 account for college, you can roll that money into an ABLE account. So you know that. Time. We've got about 10 minutes. So in 2014, the Centers for Medicaid and Medicare Services issued a new rule. It's called the HCBS Settings Rule. It requires that all the settings in which Medicaid reimburses home and community-based services, that they're integrated and support full access to the greater community. It also means that give people opportunities to find work and to spend time with others that don't have disabilities. So for a long time, we were over here on the left with nursing facilities, ICF, and state support living centers. And then we've moved into more community-based settings like group homes, day programs, or sheltered workshops. And now they want to go from those group home, day program, sheltered work into more community living, competitive integrated employment, community services, and community activities. So what's that mean for our day programs out there? This is just all the individual criteria. Supposedly, they're supposed to be in compliance, HHSC, with this rule by March of 2023 and implemented by September 2022. DayHab will be replaced with individualized skills and socialization, or ISS, which, oh my gosh, they couldn't have come up with anything else. It can be on-site or off-site, and it will replace DayHab and HCS, Texas Home Living, and deaf-blind multiple disability waivers. So I want families to be on, this is going to be on your, it's got to be on your radar, because you're going to be asking for DayHab and they're going to say, we don't do that anymore. And now it's going to be called individualized skills and socialization. So I want parents to understand that that's going to be coming down the pike. It changes based on ratios, whether they're on-site or off-site. Again, that level of need comes into play. So yeah, it's going to be a little bit confusing. I've seen other states, instead of doing this by ratio, they just pay a different rate per 15 minutes, whether it's on-site or off-site, based on that level of need. The other thing I'm going to talk to you about too, because Medicaid waivers include Medicaid, and you can keep your child on your parent insurance past the age of 25. 30 days before, ask your insurance company, what do they need to prove that your child still has a disability and remain on parental insurance? And then get the documentation back within the 30 days of your child turning 25. You cannot go back after that 30 days and decide to get the insurance back. You could lose it very easily. So if you think you might want to keep that, your insurance that you've got through your work for your child, make sure that you get that done from, within 30 days of them turning 25. It's just really important. We did not do that for my daughter because she was able to find a job that had good insurance, but for my son, we did do this back when he was younger. So, let me see. I'm going to do some questions, but if you guys could put in here, just tell me, what did you learn? Yes, this answered all my questions. Number 1, yes, but I'm overwhelmed. 3, yes, I have questions, but I'll reach out to you. 4, yes, but I don't think waivers will be important for my child's future. 5, I'm still confused. And 6, no, I didn't learn anything. Two, 3, 4. Cool. I'm glad. It is a lot of information. I would keep going to presentations to ensure that you keep on top of this. So I've got resources. I know Inger's going to share this out with you. There's that comparison tool there. Here's the information about the change to integrated services and supports. There's the comparison tool, and here's the rates for all the programs. And then here's all the different waivers and what they do and what they are, etc. The links. So let me go in and see what the questions were. Christina, do you want to run through?
Yes, I sure will. Our first question was from Tammy. Why is SSI approval necessary to receive Medicaid associated with the class waiver? Her son was denied SSI because he was not deemed medically qualified, and the state of Texas denied Medicaid and said without Medicaid, he could not get waiver services. And they
so remember that to be SSI eligible, you have to lack the ability to work at substantial gainful activity. So that means that Social Security must have determined that your child probably could work just like everybody else. And so then you don't qualify for Medicaid. And so that may be why class said that you couldn't qualify for class services. I don't know. I would be asking Health and Human Services Commission about that. That would be a question for them.
All right. Our next question is, will having an ABLE account affect the need for having SSI and Medicaid?
Wait a second, Christina. I've got to, I had lowered my audio settings, so.
Okay.
That one, go ahead.
Yes, will having an ABLE account affect the need for having SSI and Medicaid?
No. If you get an ABLE account set up, as long as it's less than $100,000, it does not impact the resource limit. Now, SSI is going, or the Social Security Administration is going to ask for the documents related to that ABLE account. I don't know why. It does not impact SSI at all or Medicaid.
All right. Another question is, what happens if your insurance is changing yearly? It was just as you were explaining how to stay in their insurance after 25.
That's a good question. I don't know how that works. That's a real problem. Because you're gonna, it depends on, maybe if you can get it qualified with the current insurance company and then you move to a new insurance company. If you've already gotten that qualification from the old insurance company, maybe the new one will accept that. I would think that there be an ability to make sure that occurs.
Mary Jane, if I could just chime in, we had that exact same situation, and that's exactly what we did. Because my son was on his dad's insurance, and then he switched companies, and then had to reach out to the new insurance company, and we just verified that he was had a disability.
Thanks,
That's all we
Judy.
could do.
Yeah.
All right. Okay, thank you. And then did legislature include funding for ISS in budget that passed?
I think they did for like a pilot of it. And yeah, that's why I think so. Don't quote me on that. They've been going back and forth with all this stuff, and the session is never ending. So
Exactly. All right. So will being on a wait list affect if my child wants to go to college or military?
So if your child wants to go to college or military, one, if you're going out of state and your child has a waiver, you're going to have to figure out how you're going to actually keep that waiver. I know friends of ours had a son, he went off to Eastern New Mexico University. He had Texas home living. Well, they require a check-in with the service coordinator quarterly. So they came home, he came home quarterly just to do that service coordination. Another family I know, their son or daughter went to Massachusetts to college, had class waiver. And for a little while it worked, but then, Medicaid does not transfer state to state. And then if your child is going to college, the biggest thing is just depends on where you're going to go. If you've got that waiver and you're staying in the state of Texas, you can use those services, especially if you have a physical disability and you need attendant care at university. The military, that's a question I've never received. I would assume that if you're thinking of going into the military, require a waiver, I'm not sure that would work. So yeah, I don't know. That's a good question. I'll have to research that one.
All right, there was a comment here that says, okay, so keep funds in ABLE account and they still qualify for Medicaid and SSI disability?
Yes, they do.
Yeah, the answer is.
The ABLE account does not count in the resource limit. So that $2,000 resource limit, the ABLE account does not. It's not one of those resources that's counted.
Okay, so another one was, so you cannot get SSI and Medicaid?
No, you get, as soon as you get SSI, then you'll be Medicaid eligible automatically. And
Right.
so that's where you can ask, your son or daughter may have SSI right now and Medicaid because of your income level. You can ask your managed care organization whether you can access some of those community first choice services if you're on a wait list for the other ones.
Okay, exactly. And there's one question that says, what happens if I have private insurance? Can I get Medicare insurance too?
Not Medicare. Actually, what happens, so Medicare comes with SSDI, Medicaid comes with SSI. So yes, you can have private insurance and Medicaid. Usually the private insurance is first and then Medicaid. When you move into Medicare, Medicare is first, private insurance is second, and then Medicaid.
All right, thanks. And then they're asking, the last one I have is, can you please show the link to ISS information on your presentation?
Yes, let's see. It's this report, long-term care provider, compare long-term services and supports LTSS programs.
Thanks. I'm not sure if anybody else, maybe Inger or Judy, have any questions?
And please don't forget to do a survey. You can take a picture with your phone right now and, or, Christina, I think, put the link in the
She
chat
did.
box. With our grant,
Right.
we sort of need this information collected.
Exactly. I just put it again, but please ask us or email us or call us. And if I missed any question, I'm sorry, please call us or email us.
I was just getting ready to say that
Mhm.
if you have any other questions once you get off with us, go ahead and email us, give us a call, and you'll get that question answered. If we don't have the answer, we will certainly reach out to who we can get the answer for. Get the answer for you. And again, don't forget our survey. It is so important that you complete the survey.
Mhm.
And we just remember, I will be sending everyone a reminders email to remind you about our small groups. We will be having one tomorrow and we'll be working on the profile. So just remember that. And then we have a bilingual class again. It'll be starting October 21st. So go ahead and register for that class. But I always tell everyone that calls us and requests any information, I always tell them you're welcome to go onto our website. We not only have these trainings available, there are so many others that are available that you may take some interest in. So, and I want to be a good steward of your time. And I know we have taken a little bit more, so I want to thank you so much. But if you would like to stay on, want to have a private question or something like that with Ms. Mary Jane, just let me know. You can stay behind, but thank you so much again, and y'all have a wonderful weekend, and I'll see you guys next time.
Thank you. Kelly is asking if the small groups are for parents of older kids too
Yes,
with disabilities. Yes.
yes, they are.
Mhm.
And for those of you who are still on, and Mary Jane,
And how do you apply again? If Brianna's asking if we can repeat that, just what Judy said, I guess.
oh, hi, Brianna. So yeah, if you're, like my son, once he turned 18 and he receives SSI and Medicaid, and there's a program called Community First Choice. Because he is on that never ending interest list or Medicaid waiver list, whatever you want to call it, he has what we call Community First Choice. Our managed care organization through Medicaid is AmeriGroup. So what happens is that AmeriGroup and the Harris Center, because I'm in Harris County, we met and we came up with a list of things that my son could work on. Either self-help skills, skills in the community, things like that. And what you oftentimes find is that not everybody that you're working with might know all of the answers. So sometimes the parents maybe are educating some of the people that you're working with. But what you can do is to reach out to them or reach out to us, and we can tell you how to get in touch with them. My email is judy@familytofamilynetwork.org, and that's JUDY. And but it's really important that you get that, because that's support that could be for your son or daughter. It is a program, like if you make $150,000 a year and your kid is 15, you would not be eligible for CFC. But if you are limited in financial resources and on the waiver list, on the interest list, then you would be. Once your child turns 18 and becomes legally an adult, parents' income is not taken into account. So that's why at 18, we could apply for Community First Choice. And
Okay,
if you
good.
have a service coordinator through either the local authority, Texana Harris Center, you can ask them about Community First Choice. I would hope that they would have brought it up to you. But in the event that they did not, ask them, Community First Choice, how can I apply for that? Okay.
Okay,
Thank you,
thank you,
Judy.
Judy.
Thank you.
And there was another question. Can you have a Medicaid waiver and CFC?
So I replied to Amy.
Oh, you're
Yeah, I
on mute,
can't.
Mary Jane.
You're on mute.
Thanks.
So when you have a waiver, all your attendant care services are being run through the system as CFC Pass Have. You may not know that, but yes, you're getting CFC with your attendant care. It's classified as that when you have a waiver. So you wouldn't have two separate services. Your attendant care is all being run through CFC PassHab within your waiver, if that makes sense.
So people who are on a waiver don't then need to apply for community first choice?
No, they don't.
Okay,
Because they're already getting it.
got it. Thank you.
Okay, and they're saying we have class, but Pecan Valley Centers is trying to get her on CFC too. They are telling us we can be paid by both.
Mm,
Strange.
yeah, I don't think so. I don't know what local authority she's going through, but
Mhm.
Yeah. Does your child not have attendant care? It's all of them have been putting rolling their attendant care through CFC.
You can also unmute yourself, ACHKS. I'm not sure about your name. but
Amy.
you can, Amy, I'm sorry. You can unmute yourself and tell us or ask if you'd like.
Okay, can you hear me?
Thank you. Yes, we can. Mhm.
So we've been on class for several years. My daughter's 20 and she's been on since she was 9. And we were a woman reached out to us through Pecan Valley, which we're in Weatherford, which is like the DFW area. And she wanted to get us on CFC. And I said, but we're already on class and we already have attendant care through class. We can't, of course, hire an attendant because you can't hire anybody for $10 an hour. And that's the maximum that they'll pay. So the family's been doing it, but she was saying that she could do the CFC and that it would be like a dual. And I said, I don't think so. But they're doing the assessment anyway and going through the motion. But I just also want to make sure if we're going through all these motions, I want to make sure that it's not going to cancel out the class once they put through the stuff for the CFC.
Yeah, that's probably a good smart thing to be thinking about, Amy, because God knows what they're doing. Almost all the attendant care and the waivers is being run through CFC PassHab. The state did that so that it was already an entitlement, and so yeah, I don't know what they're doing. That's really unusual.
I mentioned it to her whenever she asked us to come in and do like the interview, and I don't know, she just kept reiterating, no, it'll be okay. And I was like, in my experience with Pecan Valley, as from the very beginning when she was, first born, it always felt like we knew, like what you said, we always were educating them. We knew more than what they did.
Well, yeah, that's happened.
How do you stop that process? I mean, because
at some point it's got to go to HHSC to be approved. I don't understand what
so
they're
they would
doing.
deny it.
I haven't. Yeah, I would think they go in and say she already has this.
Because we haven't been to the evaluation yet. We've only sat down with the person. So, I mean, we could just not go to the evaluation and that would just stop the process right there.
Yeah, I would try to figure out what the reasoning is behind this. I don't get it.
Okay.
Because, I mean, especially because the CFC PassHab rates are lower than I think the class rates for attendant care.
Okay. All right. Well, I'll reach out to her and maybe I'll tell her to call you so she can get educated.
To call HHSC and figure that out.
Okay. All right. Well, thank you.
Thank you.
Thank you.
And there's one question by Brianna. Can you reiterate, please, how I can get paid as a mother and caregiver?
Do you have a waiver?
Brianna, could you unmute yourself, Brianna, if you'd like to tell us? Oh, she might.
Can you hear me?
There you go.
Yes.
Yes.
Oh, okay. I know that you were saying that in some cases because of COVID that you're able to be a caregiver for your child. I'm not sure if it's like the parent as the CNA and that you're able to turn in certain hours How does that work?
Do you have attendant care already in your child's plan?
I have no plan. I'm brand
Okay,
new to
so-
everything.
So do you have Medicaid?
Going through the process of applying for Medicaid and Social Security disability, and child is age 4, will be 5 in January.
So depending on if HHSD extends the rules about attendant care and families being paid, that was supposed to end at the end of October. You may be possible but the process is going to be, you're going to apply for SSI and Medicaid, which is based on income, your income. I think one of the laws that just got passed that went into effect allow you to keep your child's Medicaid for 6 months before they do a review, but don't quote me on that. But then you're going to have to ask whoever is providing your STAR Medicaid for that attendant care. And that will be through the managed care organization, whoever you choose to do the STAR part of it. So that, I think as kids, that's Texas Children's, AmeriGroup, United for Harris County. But that's going to take probably 6 months to get that process approved. Unfortunately, it takes a long time. So if you're on Medicaid for quite some time because of your income, then you might, but in the usual circumstances, you wouldn't be able to be paid as the caregiver. But right
Okay, they're
now,
only doing that for COVID.
right
Because of-
now, because of COVID, they're allowing that.
Thank you.
All right,
Thank you,
that's all the
Brianna.
questions we had. I think that's all we had. Thank you. I think it's been
Thank you.
very productive.
I think so too. Okay, well, we'll see you guys at the next one. Don't forget to
Yes.
register.
Thank you so much.
Bye.
Thank you, Mary Jane. See you next time.